Thank you very much, Dr. Bright. The next speaker is from Uruguay. She's going to talk on improving patient access for breast cancer diagnosis and early detection in Uruguay. I'd like to introduce Dr. Gabriel Krygier. He's the director of the National Breast Cancer Registry. Is it Breast Cancer Program? Sorry, National Breast Cancer Program in Uruguay. Thank you.
Good morning to everybody. First of all, I would like to thank Dr. Benjamin Anderson and Dr. Eduardo Casap for inviting us to participate in this beautiful meeting. We are trying to show our experience in Uruguay, improving patient access for breast cancer diagnosis and early detection in our country. This is our National Cancer Institute, where we are placed now and we are working in this program. And this is the Clínicas Hospital, where the human resources are coming and we are collaborating, working together. As you realize, Uruguay is a very small country in between Argentina and Brazil. This is our surface, 176,000 kilometers square. This is our population, a very small one, 3,300,000, half men, half women. The percentage of total death in 2006 and leading causes of mortality in our country, the malignant tumors take 23.5% of all the diseases in our country. Secondly, after the circulatory system diseases. It's a very important problem for our country to realize. This is some demographic data in Uruguay that has changed, as we realize, in the last century, 1908, and nowadays, with the aging of our population. And if you realize by sex and racial ancestry, our population mostly is white. There are some mixed white African, Indian white, black or African, but mostly 90% are white population. These are the comparative mortality versus incidence leading sites in females, 2002-2005. We are very proud of our national data registry. It's a very trustable one in Latin America. This is our incidence in breast cancer is the leading cause in incidence and mortality. As you realize, for women, 73.4 incidence and 22.7 mortality with a ratio 3.2. The second is colorectal cancer, cervical cancer, lung cancer, ovary, and all the rest. And this is very important. The long-term trends in cancer mortality rates in Uruguay and the leading side has decreased in the last years, especially as you realize in breast cancer. This is the leading cause, and it decreased usually, and we think probably because of the consciousness of the people that come very early to the detection, and of course of the adjuvant new treatment that we are using in breast cancer patients. You have here, this is the incidence and comparative mortality versus incidence in breast cancer in Uruguay. 1,800 people incidence in breast cancer a year in Uruguay, and 630 mortality in Uruguay. As you realize, we are very like the developed countries, both in incidence and mortality, with a mortality incidence ratio 0.29. Very, very close, as you realize, a developed country, 0.27, and the developing countries, 0.44. This is our staged presentations in Uruguay, the breast cancer in Uruguay. As you can see in this table, most of our patients, stage 0, this means in situ carcinoma, 11%, stage 1, 41%, stage 2, 21%. So 75% of our patients, our breast cancer patients, are presenting in early stage breast cancer. We can have only less than 20% stage 3 and less than 8% stage 4 disease in our country as initial stage presentation. In 2005, the National Cancer Program in Uruguay was launched. The director is Dr. Ignacio Muse, sitting with us here, and one of his aims is coordinating all cancer activities through the public and private sector and assessment and promotion of cancer policies within the regulatory authority, the Ministry of Public Health. In 2008, the National Integrated Health System was created, is regulated by the Ministry of Public Health, integrating public and private institutions, half and half, and covering almost 10% of our population. We had a great advantage in our country. In 2005, our elected president was an oncologist, was specialized in radiotherapy, Tabaré Vázquez, maybe lots of you know him, and he allowed and promoted the development of all cancer policies in our country. He is Tabaré Vázquez. He has just finished his presidential election in March this year. And this is Dr. Casap visiting us in Uruguay during our meeting Congress. Dr. Clifford Haddis from the breast unit in the Memorial Sloan Kettering Cancer Center at this time visited us too. So what has been done among population in our country? We have now a national oncology network. Our breast cancer patients, they have consciousness among female population as to reach to the mastology units very early. We have a very homogeneous distribution of mammographic equipment, both in public and private areas in the country, and we have an easy and rapid access to the mammographic units based in hospital, specific crowded areas, or portable mammographic units. Among clinical breast exam, we have very lot of human resources, well-trained in clinical breast examination around all the country. We have centralized database that provides online information between the clinical breast examination office and the mammographic database department. We also have a computerized national clinical breast exam data registry daily actualized with the new information provided. And we also provide to our patients illustrated public materials related with the self-breast examination and clinical breast examination. This is our data sheet for clinical breast examination that is easily filled by all the physicians and nurses all over the country. What is left? Assessing the planification of a pilot program for breast cancer screening nationwide, defining the economic and human resources for that pilot program, and determining the usefulness of implementing a national breast cancer screening program, improving, of course, the quality control at the